Gastrointestinal GI endoscopy is an essential procedure used in the intensive care unit to diagnose and treat conditions affecting the digestive tract. It involves the use of an endoscope, a flexible tube with a camera and light, which is inserted through the mouth or anus to visualize the GI tract. This procedure allows healthcare providers to identify and manage various GI issues in critically ill patients. GI endoscopy is indicated in the ICU for several reasons, including diagnostic evaluation of GI bleeding, abdominal pain, or unexplained weight loss, assessment of esophageal, gastric, or duodenal ulcers, biopsy of suspicious lesions or masses in the GI tract, removal of foreign bodies or polyps, treatment of esophageal varices or GI obstructions, evaluation of persistent nausea, vomiting, or diarrhea, caustic ingestion, placement of feeding tubes for nutritional support, endoscopic retrograde cholangiopancreatography, endoscopic colonic decompression. Preparation for GI endoscopy involves several steps. Patient consent. Informed consent must be obtained from the patient or their legal guardian after explaining the risks and benefits. Pre-procedure evaluation. A comprehensive medical history and physical examination are conducted. Blood tests, imaging studies, and ECG may be performed. Fasting. Patients are usually required to fast for several hours before the procedure to ensure an empty stomach or colon. Medication management. GI endoscopy procedure consists of the following steps: sedation and anesthesia. Patients receive local anesthesia and sedation to promote relaxation and minimize discomfort. Insertion of the endoscope. Depending on the type of endoscopy, the endoscope is inserted either through the mouth, upper endoscopy, or the anus, colonoscopy. Visualization and sampling. The endoscope's camera transmits images to a monitor, allowing the physician to examine the GI tract. Tools can be passed through the endoscope to collect tissue samples, remove polyps, or treat bleeding sites. Completion. The endoscope is carefully withdrawn. Continuous monitoring to ensure patient safety. While GI endoscopy is generally safe, potential complications include bleeding. Minor bleeding at biopsy sites or polyp removal sites is common, but significant bleeding is rare. Infection. There is a small risk of infection. Perforation. Rarely, the endoscope can create a hole in the GI tract, leading to perforation. Cardiovascular events. Rarely, arrhythmias or other cardiac events can be triggered. Contraindications. Coagulopathy. Unstable patients. GI perforation.